Good afternoon, everyone. My name is Sarah Hunstead. I am a paediatric nurse, a mum of two, and founder of CPR Kids. And at CPR Kids, what we do is empower parents and families with the life-saving skills of baby and child first aid. And I have the absolute pleasure of talking today with Dr. Nadia from Cub Care, all about allergy and anaphylaxis. This is just part one of our series that we're going to be doing on this. And Dr. Nadia is rather an expert in this area, but I will let her tell you why that she is. But before we go any further, what I'd love to do is just tell you what we will be covering in this session. So we're going to be covering what is allergy and anaphylaxis, what are the signs and symptoms of both mild to moderate and severe allergy or anaphylaxis, what to do when it occurs, how to use an EpiPen, and tips on EpiPen storage and so on. And please remember, feel free to ask any questions you want. Type them in the comments below. We will get to them as soon as we can during the session. And what I would love you to do while Dr. Nadia introduces herself is give us a wave or a thumbs up just to make sure that all the technology is working as it should be. So over to you, Dr. Nadia. Please introduce yourself.
Thank you so much for having me. As Sarah said, my name is Nadia. I'm a paediatric emergency physician, also mum of two. And I guess the reason I'm a bit of an expert in allergy and anaphylaxis is that I have some life-threatening allergies myself, and my daughter, who's now about to turn 6, had previously anaphylactic range allergies, now improving to the point that it's more food intolerances. But yeah, it's been an interesting journey helping her learn about that and learning a lot more myself than I ever would have known otherwise, I think.
Yeah, absolutely. I think it's really, when I say it's important, I think, obviously we don't want anything to happen to our own children or to ourselves, but it is such a learning experience as a clinician being on the other side. And I think it makes us better doctors and nurses when we do have that understanding. And, it just a completely random occurrence where, we had this booked in, we've been planning this for a little while, and just yesterday I got my own diagnosis of anaphylaxis, and I need to carry around an EpiPen myself. So I think I'm going to be learning a lot today as well. I know. What about the timing? Unbelievable. Yeah. So, when you think about this, so many of the population actually do have allergy and anaphylaxis. So really, it shouldn't be that surprising. So let's get into this. What we would love to know first, Nadia, is can you explain to us actually what allergy and anaphylaxis is?
Sure. So just in very simple terms, allergy is when a person's immune system reacts to something that should not cause them harm. And that reaction causes inflammation, which goes on to cause damage and make you feel pretty rotten, to be honest. So those allergens, meaning the things that should be harmless, but in the case of allergy cause harm, they can be a whole variety of things, from medications, food, insects, dust mites, pollens, molds, pets, latex in my case, but really any number of things can cause allergies. And then the exposure also can be touch, something you breathe in, something you eat, injection in the case of both medications and insects. So there's a whole range of things that can cause allergy and anaphylaxis. And then what happens during the reaction, so it's essentially inflammation in various parts of the body, and as relating to where that is what determines how severe the reaction ends up being.
Yeah, absolutely. Thank you. So, I think that what's important is that if we do have an understanding that this is something that is a reaction in the body, what we will also do is link in the comments below, because we're on limited time today. I think Nadia would be able to talk why this happened for at least 2 to 3 hours. So for those of you who want to take a deeper dive into exactly what is happening inside the body, we are going to be putting links all in the comments below for you to be able to do some further reading as well. So that's an important thing. So now that we have an idea of, what allergy anaphylaxis is, I'd love you to, could you just quickly just do a little recap of what the difference is between just an allergy and anaphylaxis, just that quick little definition. Now, I suppose what I'm getting at is, my understanding is that an allergy is a mild to moderate reaction and a severe reaction is classed as anaphylaxis. Is that correct?
Yeah, that's absolutely right. So the severe end of the scale where the reaction becomes life-threatening, that's what we call anaphylaxis. And there's a whole list of symptoms that are included in what is anaphylaxis, which we'll go through. But I think the way I find it easy to understand is it's when your breathing and airway are affected or your circulation, your blood pressure drops. Those are the important things that can kill you, whereas the itch and the rash and the other things are just annoying.
Yeah, excellent. Thank you. And we will go through those signs and symptoms in detail very soon in this presentation. So let's get into exactly what the signs and symptoms are. Now, Nadia put together some fantastic pictures for us as well, so we'll be able to look through this because it can be very visual what's going on. But I think one thing that certainly that Nadia and I talked about before doing this is we want to put a great big hang on for a sec out there. And that is, before we go into this, you must realize you do not have to look like these pictures to be having a severe allergic reaction. You do not need to be looking like this, okay? These reactions can happen without rash, without swelling. So we're going to show you what they can look like, but it doesn't mean that the person having a reaction must look like this. Okay, just a little caveat before we go into it. So I'll start to share our screen now. So here we go. We've jumped into the little boxes on the corner. Would you like to explain to us about what we're looking here?
Yeah, so these are your typical allergic rashes. So the name urticaria or wheals, hives, welts, all sorts of different names are used to describe this rash. And again, you can have a rash that looks quite different to these typical rashes, but they're the types of rash that we often see. With an urticarial rash, it can move around your body and look different at different times. You'll often see scratch marks because it's incredibly itchy. And with time, you get that kind of central clearing in the middle of the hives. So that's one of the symptoms that can be present in severe allergic reactions, but also can be just a mild allergic reaction, even if it's quite extensive and looks quite distressing. The other thing that we see with, again, either the mild or severe types of reactions is you can get this swelling. Facial swelling is the most common. So you can see in this picture the eyes are all red and swollen around the eyes. You can get lip swelling. You may or may not have hives along with that swelling. So it's really quite a variable picture. So you can see the child on one side with the big swollen eyes, lips look totally fine, and the other child has those big swollen lips, but his eyes look okay. They both look uncomfortable. But yeah, you can't really tell how severe a reaction is just from these skin and soft tissue kind of signs. So any of these children in these pictures could be having anaphylaxis, or they could be having a mild to moderate reaction.
Absolutely. And I think that's one of the important things as a parent or carer is knowing the signs and symptoms that your child displays when they have a reaction, and making sure that everybody who's caring for your kids or kid or child who has got this reaction understands what their specific signs are. And I think that's an incredibly important thing. We need to be having lots and lots of conversations about this so that everybody is aware, because every child is different. And I think that's very important. So we've had a look at what some of the outward signs and symptoms are. Let's go into just a mild to moderate allergic reaction. I've got a little slide here. Could you talk us through what the signs and symptoms of a mild to moderate reaction will be?
Yeah, so this is the summary of symptoms essentially. So with swelling of the lips, face and eyes, you can have that typical urticarial rash, tingling mouth, is sort of a warning sign, I think, that things could potentially become more serious, but not necessarily. My daughter certainly had tingling mouth with every reaction she had without having anaphylaxis.
Yes.
Abdominal pain and vomiting, I think, is an interesting one. So I would classify that mild if it's an ingested allergen, so something that you've eaten. If you've been stung
So
by an
food or something like that. Okay.
food, then I think abdominal pain and vomiting, you can class it in the mild category. But if it's an insect, you can't really see how that should cause a localized reaction in your stomach. So I think take that seriously. If your child has a bee or other insect allergy, that might be a sign in that case of anaphylaxis.
Yep, absolutely. And I think one of the important things too is that if your child has never had an allergic reaction before, and they do have one, so they have the swelling of the lips, face, or eyes, they do come out in the hives or welts, and perhaps they're, complaining of that itchiness, the tingling, and so on. If you are unsure about what is going on with your child and it's their first reaction, you can't go, oh, we'll just wait and see if it gets worse. I think one of the most important things, particularly if it's the first time, that you do get medical help immediately, because you can't predict what's going to happen next. And I think that's an incredibly important thing, particularly with that swelling. You don't X-ray eyes. You can't tell whether or not their airway is starting to swell and so on. Err on the side of caution and get urgent medical help. But if your child does have a diagnosis, then of course you're following their action plan, which I'm not going to talk about yet because Nadia will be talking about that later. So we've talked about the signs of mild to moderate allergic reactions. So remember, this is the non-life-threatening. But can you talk us through this? What are the signs for the life-threatening?
So I think the first important thing to say that's actually not in that slide is it can progress incredibly quickly. So you may have a child who's never had anaphylaxis before, who has allergies, who's had urticaria, that you're kind of sitting with them, watching them, maybe administering some antihistamine if you have some, but maybe not. But be alert for these symptoms always. I like to divide this list into the ABCs of resuscitation, so airway and breathing, are really the column on the left-hand side, plus your difficulty talking. So that noisy breathing, it sort of sounds like often, but not necessarily. Again, tongue swelling rather than lip swelling is an important differentiator, but if in doubt, assume that the tongue is also swollen if you can't see it. Swelling or tightness in the throat, wheeze, or just persistent coughing so much that you can't catch your breath. And I've seen a child have an anaphylactic reaction to cough medicine, so that sometimes it's confusing. So they were coughing already, they had the cough medicine and their cough got dramatically worse. Yeah, that was a bit of a delayed recognition for that child. They were transported before it became apparent that they'd had this cough medicine. So the treatment took a bit of time to figure out what it was. Whilst the reaction was treated very appropriately, it wasn't clear for a while what had caused the reaction. Difficulty talking and a hoarse voice. For me, this is the first symptom when I have reactions. It's useful if you happen to be talking, but if a child suddenly goes very quiet and stops talking, that also might mean that they have difficulty talking. If they're not answering your questions when usually you would think that they would, then that might be something to be concerned about. And the last two, the dizziness and collapse or pale and floppy, those are signs of low blood pressure. So your child might, instead of those things, become incredibly irritable. They might just not respond to you appropriately. So those are the more common ones. But if your child is excessively irritable, that's also something to be worried about.
Yes, absolutely. And I think as, paediatric clinicians, that we've seen this 1,000 times, where a parent or a carer will actually bring in their child because their gut has told them that something is wrong, and it's their behavioural changes that are actually just alerting the parent that something is incredibly wrong, but perhaps the other signs and symptoms aren't as obvious. And that's why we really, really need you to trust your gut when it comes to anything like this around your child's health. Trust your instinct. It's really, really important. And I think empowering yourself with, information like this today, so you do have in the back of your mind what these signs and symptoms are and have the ability to, seek medical help when you need it. Trust your gut and go and do it. It's really, really important. So they are, yes,
in the baby age group, they sleep so often, but if they're sleeping at a time they're not supposed to sleep, usually, and they've just had something, and maybe they have some other signs, but even if they don't, if they just become excessively sleepy after eating something, that might be your only warning. So trust your instinct. If you're thinking, well, they're not supposed to be asleep for 2 hours, get it checked.
Right. Excellent. Great advice. Thank you so much. Now, so what we've done so far is we've talked about what allergy and anaphylaxis is. We've looked at the signs and symptoms for both mild to moderate allergy and also the severe, which is anaphylaxis, the life-threatening. So what we'd like to go on to now is, what do you do? So if your child does have anaphylaxis, they have this severe allergic reaction, what are we going to do now?
Okay, so the first thing, and I'm going to run through how to give the EpiPen, but I wanted to spend a bit of time talking about the position that the child should be in. So as parents, our instinct is pick up our child. So yes, pick up your child, but don't hold them like this, hold them like this, so that they're getting enough blood flow to the important parts of their body, so their heart and their brains.
Yes.
So that's actually surprisingly important. And try to keep their legs kind of straight and a bit up if you can. And then I can talk through how to use the EpiPen, but I think getting that position right first is important. So if you give me 2 seconds, I'm going to just maneuver my camera a little bit.
No problem. Just while you're doing that, what I might do while you're getting ready is we're going to, Dr. Nadia is just going to show you how to give the EpiPen, but where we're actually getting all of these things on the screen from is from one of these. This, and this is mine, is the ASCIA, which is the Australasian Society of Clinical Immunology and Allergy. It is their action plan. If your child or you have allergy or anaphylaxis, you need to have an action plan. There is no two ways about it. And so what you're seeing on the screen is actually coming from this action plan. So first of all, if your child does, you suspect or they are having a severe allergic reaction, anaphylaxis, you do exactly what Dr. Nadia has just said. We must lay them flat. You can see in the pictures on the screen here what you were doing for an older child, and Nadia demonstrated what you would do with a younger child, having them flat in your arms with their legs up. And this is incredibly important. Do not allow them to sit or stand. Very, very, very important. The next thing we're going to do is give the adrenaline autoinjector or the EpiPen. So I am going to just find my mouse again. There we go. Oh, the technology. It's challenging my brain doing all of this at the same time. I am going to bring Nadia up on so you can see exactly what she is doing there. There we go. Nadia, you now have the big screen. If you can please demonstrate to us what we're going to do.
Sure. So we have our child here, hopefully lying flat. If their breathing is too difficult in that position, sort of a 45-degree angle is okay, as long as their legs are nice and straight. Then you hold the EpiPen nice and firmly in your fist. There's a little rhyme, blue to the sky, orange to the thigh. That helps you to remember. But you're holding it like this and you're keeping your fingers away from either end. The next step is remove the blue safety cap. Now you can inject through clothing, but avoid pockets or seams. You're aiming for the outer part of the thigh, roughly around the middle. You can go through clothing, as I said, so we're just going to press here until you hear a click. You have to press actually a bit harder than you would imagine. And then you hold it there for 3 seconds. 1, 2, 3. And then you remove the EpiPen. So this orange thing comes down and protects the needle so that nobody gets hurt. And then you cool it.
Excellent. Now, in an ideal world, we would have a child who would be compliant with that. There is a possibility that they may be very compliant because they are so unwell that they cannot actually, they just can't be fighting against you. But if they are in a position where they are quite agitated, they may be very, very scared because they can't breathe properly. And often I've heard older kids and adolescents say that they felt like they were dying, like this awful feeling of impending doom on them. And that can you imagine being 2 or 3 years old and having this feeling? It would be terrifying. So that's why if there is another person to be able to help you, if they are being a bit combative, generally they'll be pretty unwell though, so really, but somebody that if one of you are able to hold the child and the other one is able to administer the pen, then that can be a really good thing to do if there is more than one of you around. There are different ways that you might be able to hold your child as well if they are squirming a little bit, such as in your lap and being able to pop one leg over their legs and so on. But it's about, at the end of the day, they need it. And I think one of the golden rules about giving an EpiPen as well is you always err on the side of caution. If you think they need it, you give it. It's not going to do them any harm if you administer it and they don't actually need it. So we'd much rather you go, okay, let's give this, rather than think, I'm not sure, I don't think I will, I'll hold off. And that can be really concerning because, as Nadia said before, this can progress very, very, very quickly. So always err on the side of caution. And I think from experience as well, one of the other golden rules is that if you aren't familiar with the pen, okay, you have the 10, 15 seconds to look at the instructions on the pen quickly before you give it. Take that 10 seconds and give it right, rather than going and doing that. You do have that time. Look at it. It will take you 10 seconds and then administer it. Okay, perfect. Excellent.
I just add, I've never seen a child come to the emergency department who's been given an EpiPen where I've thought they didn't need it. I think trust your instincts. Your instincts are correct. If you're worried, give the EpiPen and don't worry about making mistakes. Parents usually get it right. I have seen people who think they should have but weren't sure, and it takes longer to recover and it takes more doses if you delay.
Yep, that's exactly right. Yep. Err on the side of caution and do it. Okay, excellent. Let's go back to sharing our screen again, because what we'd like to do is just go through the rest of the action plan as well. So we've given the adrenaline auto-injector. So we're really important. We want you to know what time it was as well, because that's, the doctors really want to know at the hospital as well what you've given. Have the used EpiPen and transport that with them, because when the ambulance arrives, have that go with them as well. And of course, that's the ticket there. We want the ambulance coming. As soon as we've given this, call 000, shout for help, do whatever you need to do to get help for you and your child, because you don't want to be hanging around without those paramedics coming. We really want them coming, and that's important. And of course, if you are a caregiver, such as a teacher or daycare and so on, then of course letting the emergency contact know what's going on. And remember, you can give additional doses of this if no response has happened after 5 minutes. And remember, that is very clear on the action plan right here. And the important thing to remember too is that if they've had one of these, they get a ticket to the hospital. Even if they seem like they're fine, we're not keeping them at home. They need to go to the hospital. There is just no two ways about that at all. And of course, as we said before, if in doubt, they need that EpiPen. And the important thing to remember as well is you need to be prepared to start CPR if you need to. So if they become unconscious with abnormal breathing or no breathing, we are getting on their chest and we are starting CPR. So that is another important thing. So now that we have been through that, a reminder again that we do not let them sit up. We've got them laying flat in our arms. Nadia has been through how to give the EpiPen as well, which is certainly one of the most important things you can know how to do. And you never know when you might need it. You never, ever know. You might be a woman sitting next to you in the cafe that you're having your coffee at who says, I'm having a reaction, get my EpiPen. And she might be unconscious by the time you pull it out of her handbag. So even if there's nobody in your life who has this, I encourage you to know what to do and how to do it, because you never know. So Nadia, do you have any tips for us about EpiPen storage? Or, because, you know, your experience with both yourself and your daughter, you will have 1,000 tips for us. What would you like us to know?
Yes. So keep them in the cases that they come in. Don't kind of store them in your handbag like this for two main reasons. You can damage the EpiPen, but also the expiry date gets rubbed off by the other things.
Aha.
So you need to know and check on what the expiry date is. The other thing that we did, particularly when my daughter was still in nappies, we had 2 bags with us when we went out. So I had my EpiPens in my handbag. She had a bag with her changes of clothes, nappies, etc. The EpiPen stayed in her bag, and that bag went wherever she went. So if I went to the bathroom and she was staying with my husband, he would have the bag that had her EpiPens, because you just don't know what's going to happen. You can take all the precautions in the world, but somebody can walk past with an iced latte and spill it on you, and your child has a reaction to milk, or a bee can fly by. So it stays with the child all the time. The temperature recommendations confuse people a little bit. So the guidelines are between 15 degrees and 25 degrees, but probably up to about 30 degrees is okay. If your EpiPen is likely to be at higher temperature than that for here in Queensland, or colder temperatures in other places, then you can get these little insulated bags that you can keep the EpiPen in. So if you work outdoors and there's nowhere cool to store your EpiPen, then you can just get an insulated bag to keep it in.
Like a kid's lunchbox.
Yes. Yeah, exactly like that, but smaller and brightly labelled. Those are the main things really that I can think of. I think always have 2 EpiPens is the other important thing, and there were some supply issues with EpiPens a little while ago, and so sometimes people were left with fewer for a brief period of time, but always try to have 2. If you're traveling somewhere far away, you can buy extra without a script, so you won't get the PBS discount necessarily, but if you need 3 because you're going, well, when we're allowed to travel overseas and they don't have EpiPens available in that country, so you want an extra one, then that you can organise that.
Yeah, I think that's a very smart thing to do, of course. And I think that importance of, you know, having them present at all times, it's not an option not to. It really isn't. If you've been prescribed this, it's for a very, very good reason. Now, one question that we often get is, can you, for example, if you've got a child who has an anaphylactic reaction in front of you, now, is, for example, a 2-year-old, their only thing available in the first aid kit where you are, because lots of centres and so on will have EpiPens in their first aid kits that are not prescribed for someone, but they are part of the kit. Can you give an adult EpiPen to a child? Will it do them any harm if that is the only option that you have?
I think too much adrenaline is much less dangerous than no adrenaline. So if you have only adult EpiPens available, then give the adult EpiPen.
Yeah, Absolutely. So yes, I think that is fantastic advice there. I would much rather, exactly, I'd much rather somebody use that on my child and save their life than be worried about not doing that. So we do have some questions before we finish up today as well. And just one thing I'd like to say is that we can't give individual medical advice. If you are concerned about your child and you would like somebody to see them, then, of course, as long as it's not life-threatening at the time, you can jump onto Cub Care and have one of the Cub Care doctors have a look at them if they've had, they've got a rash or something like that in the evening. But what I would encourage you to do is go and see your GP or your paediatrician if you have ongoing concerns and, you concern your child has allergies. They will then either be able to refer you on to a paediatric allergy specialist if that is what your child actually needs. So we can't do individual medical advice here today. That's an important thing that we want you to remember. So one question that we have is that from Holly, that just in summary, she has said that after seeking medical advice about her daughter, she's been told that she has allergies and eczema. And so what she's heard is that in small children, sudden onset of allergies could lead to anaphylaxis. So are all these things intertwined? If your child has got a diagnosis of allergy, can this progress into anaphylaxis?
It's a bit individual, but so essentially the conditions, eczema, allergy, hay fever, they all go together genetically. So if you have one, you're more likely to have the others, or if you have one, your child might have one of the other things, but they've inherited that tendency. And we call that ATP. But essentially, if you have eczema, you might be more likely to have allergies to foods and things, but equally, many people have eczema who don't have allergies. So they can go together, but they don't always go together. It is important, though, with managing eczema that you don't use creams that contain food proteins. So that's part of the ASCIA advice, but there are lots of products out there that have food proteins in them. So please just be careful with the ingredients of things that you're putting onto the skin.
Thank you. Some more great advice there. And I think the important thing is awareness that if a child does have allergies, that you do have it in the back of your mind that, perhaps it can progress. And if they do have a reaction, you simply have those, your spidey senses out and you're watching. I think that's a really important thing. So we also have some more questions on here that are really a little bit specific to kids, to individuals. And so what I'm encouraging you to do there is please go and see your doctor and discuss your individual circumstances with them. I think that's an important thing. Now, Melissa has actually asked, is there a place where we can donate unused expired EpiPens for training purposes for medical students and so on? So we actually have these, which are trainer pens, which don't have the needle or the adrenaline in them. So what I would encourage you to do is that if you have your active EpiPens as such, if you take them back to your pharmacy and they will do whatever needs to be done with them. So don't chuck them in the bin, any of that kind of stuff. Once they have expired, they need to go back, obviously being replaced, and going back to the pharmacy, and they will do whatever needs to be done with them. And another question that we have had, if an EpiPen is certainly, it just expired, but there's nothing else around, would you use it?
Yeah, absolutely. Absolutely. So there's been a lot of studies, actually, they're probably good to still use for several months afterwards. But I mean, obviously the advice is replace it as soon as possible, close to the expiry date. But if that's all you have, then use what you have.
Yep, absolutely. So we have a question is, how likely is a baby to grow out of anaphylaxis or the severity of an allergy? That's probably an individual thing again. I think we're all, with our kids, all very, very different. So that's a bit of a trickier one to answer. But in your experience, Nadia, your daughter has, in fact, grown out of it, hasn't she?
Yes, so she had initially allergies to milk and fish and intolerance to soy. She's left only with intolerance to milk products. So So the way that we find that out, though, is regular appointments with the immunologist who repeats the skin prick test. You have to remember certain instructions with those tests, like not giving antihistamines for a week beforehand. But she grew out of her allergies when she was around 3.5, I think, close to 4. So it's made things a lot easier. And even though she still has that milk intolerance, like tiny amounts are not going to harm her in the way that they would have previously. So it's kind of revolutionary. We can eat chips in places that also cook, that it might use the same fryer. So like simple things, it's really alters your life having an allergy and having a child with an allergy. But I think it also teaches compassion, and she's a very kind little girl. She always thinks about other people and how things might affect them. And her friends also have been incredibly kind. Like when she's invited to birthday parties, she'll say, "Oh, I'm allergic to milk," and they go home immediately and say to them, "Mama, what are we going to do?" Like, "Don't worry, I'll send her with some cakes. It'll be fine." But I think children are very inclusive, and don't be afraid to talk to them about their allergies, and it gets easier with time.
That's reassuring.
Start with. And especially when it's your child, and particularly if you're the person who maybe they've inherited that tendency from, there's a grief period that you have to go through. Certain things in life will be more difficult, but they become easier with time, and it's a big group of people in the same situation.
Yes, no, absolutely. Yeah, and the support is there. And so I will also put links as well to Allergy and Anaphylaxis Australia down below, which has a lot of support as well. Now, we do have, if you've got time, we still have quite a few more questions, if that's all right. This is a very, very popular topic. Lindsay has actually asked, should you always try antihistamine first? Now, I guess we need to kind of break that down a little bit, that you need to be following your child's action plan, that's really, really important. If they are actually having anaphylaxis, then this is what they need. But I guess the question is, and this wraps into another question that Jessie has actually asked, if your child is having an allergic reaction, they've never had a reaction before, you don't have an EpiPen around, what would you recommend that they actually do? Is it okay to give an antihistamine, or are we getting straight on the phone to 000?
So it depends on the severity. If it's a severe reaction, just call 000 if you've never had a reaction before and don't have an EpiPen. If your child has a known allergy and they're having a milder reaction, so they don't have any of those signs or symptoms of anaphylaxis, then you can absolutely give them some antihistamine. I would choose a non-sedating one because the sedation can confuse things. But aside from that, yes, you can give one, but it won't prevent a reaction that's going to progress from progressing. It will just treat the symptoms that are the annoying symptoms. So the itch and the rash and those sorts of things will be helped, but it won't treat anaphylaxis and it won't prevent anaphylaxis.
Okay, thank you. I think you've answered that really, really nicely there, actually, that it's about being familiar with what is a mild to moderate reaction, what is a severe reaction, know the difference between it, and if in doubt, get on the phone, call an ambulance. What's the worst thing that happens? Ambos rock up to your house, they say, no, everything's okay. That's best case scenario. You know, you want them there if you are in fact really concerned about what is happening to your child. And so I think that is definitely an important thing. So, okay, Mary has asked another question as well. Do you know if other medication masks the mild allergy symptoms? So we've just talked about antihistamines. So I think that is well answered. Can medication hide an anaphylactic reaction? Nadia, you've just answered that in the fact that it will progress, that nothing is going to stop that. If they are going to have an anaphylactic reaction, that will actually progress forwards. Now, Rebecca has also asked, what's the best way to test for allergies? Is it skin prick or blood tests? Can you comment on that, or would you recommend that Rebecca goes and has a chat to her pediatrician?
Yeah, I think that's a bit of a specific question. There are blood tests that we sometimes do, but not so much looking for anaphylactic type triggers. If you have hay fever symptoms and you're looking to find out what are the potential aeroallergens like dust mites and things, then yes, skin prick tests are probably the better test, but less easily available. But I think it's very, very specific to the situation, and something that you need to discuss with your GP first of all as to which referral pathway to take. Probably an allergist, pediatric allergist, would be the person to answer that question based on more specific information.
Yeah, I think that's important. We need to remember that what we can tell you that is generic, that is out there, is what the first aid is, being able to follow that action plan, what to do if your child does have their first reaction. But a lot of these other questions are really specific to your child and your child's needs, and that's a little bit impossible for us to answer over here. But one more question before we finish up today, and I have, I've just missed it. Oh, here we go. Okay, so Holly has asked, is there only one EpiPen type, or are they specific to allergies? There is only one EpiPen type. What it contains is adrenaline, and the aim of what it is doing is basically combating that reaction or pausing that reaction. Nadia, you might want to just give a little more information on that.
The EpiPen Junior and the EpiPen, the medication is the same, the dose is different. So the EpiPen Junior is green, and the pictures on the side are green as well as the packet, whereas the adult one is more of that yellow colour. The Epipen Juniors are for kids between 7.5 and 20 kilos, and the adult one is for kids over 20 kilos and adults. But there are other devices not commonly used in Australia, though, so I think most people would have an EpiPen rather than Anapens or different types of devices.
Yes, that's correct, absolutely. So I'm just double checking that there aren't any other. There we go. I think we're pretty much done with all the questions, and I apologise. It looks like we have had some spam put into our comments as well, so I apologise for that. I will clear all of that out when we are finished. It's really annoying when that kind of stuff happens.
Yeah.
Right. Yeah, especially when we're trying to give good evidence-based information. So what we'll do is that I will pull all of that out. I will put lots of links in the comments below for you to do, your further research as well. And what we are going to do is we will bring you part 2 of the allergy and anaphylaxis talk. So keep an eye out on our pages for when we put that up into the events. But what we'll be talking about is, how do you keep your child safe once they have been diagnosed with a life-threatening allergy? Some tips from Nadia on reading the labels of things that we might not expect, such as shampoos and so on, because, some lotions, as Nadia was saying before, do contain foodstuffs, and that's important that we are aware of that. How you can help your child, how they can help keep themselves safe as well, and also some information on food phobias and fussy eating. And, certainly I'm just seeing a comment come up here. It can be difficult when you have 2 kids with different allergies. I think that would be incredibly difficult. And Sarah has just said, how do you keep both children safe with this? That is something that I think would be incredibly difficult. We will delve into that in part 2, because otherwise we will be here for the next 3 hours, and I'm sure that there are children who need Nadia looking after them today, so we'd best let her get back as well. So we will cover that in our next session. Keep your eyes open for when we're going to bring that in the next few weeks on the event pages. I hope this has been really helpful. And Nadia, you have been an absolute wealth of information. Your personal experience brings so much to this as well. Thank you so much for joining us today, and I can't wait for the next one.
Oh, you're most welcome. Thank you for having me.
Okay, and remember, jump on the CPR Kids website for all of your first aid training when it comes to kids, and Cub Care after hours pediatric emergency care via the interwebs. Absolutely fantastic. So jump on the Cub Care page and the Cub Care website to see all about what they do. Okay, we'll see you soon, everyone. Bye-bye.
Bye, thank you.